Striking doctors now say that only the president can unlock the impasse that has left thousands of Kenyans without access to public health care. The medics union says efforts by government representatives since the strike started have not been successful and are accusing them of being non-committal to ending the strike. Brenda Wanga reports on the strike that has also been worsened by the clinical officers' strike that entered its second day on Tuesday, with the laboratory technicians also set to join in this week.
For the 20th day in a row, Kenyan doctors working in public health facilities are not at their places of work. Donning their white coats and protective gear, they have turned the streets into the theater of their protests against their main employer, the government.
Tutaendelea na mgomo mpaka ile CBA ya 2017 ambao tuliafikiana those 7 years ago itimizwe kwa kikamilifu.
Na kama serikali iko tayari kwa mazungumzo ambayo yatazaa matunda, wanafaa wahakikishe kwamba magavana ambao wako na rekodi mbaya kama hawa hawaingii katika vyumba vya majadiliano.
The doctor strike, the second major one since 2017, continues to paralyze services, denying thousands of Kenyans solely dependent on public hospitals much needed and often life-saving health services. Naman Okot's family from Homa Bay has felt the impact of the strike. Their daughter in physical pain. Her parents emotionally tormented at the thought of what might befall them if she does not get the help she needs. This hospital, like 100 others across the country, remains in the throes of the biting doctors and now clinical officers' strikes.
Alikuwa na shida hapa kwa tumbo yake. Alikuwa na heart problem. Sasa naomba, sina hata kitu, sina pesa.
Their only hope of any assistance lies hundreds of kilometers away, nearly out of reach both physically and financially.
Daktari waliniambia wanataka kupima, sijui hakuna 3 samples hapo inafaa pimwe, na kupima hadi wa leo. Walituambia leo inafaa wapimwe, ikifika asubuhi daktari alisema sasa hiyo haitafanyika.
Scenes like this are replicated across the country as some hospital wards and waiting bays remain either deserted or simply shut. At the Nakuru Level 5 hospital, patients seeking specialized services are receiving the bare minimum as the doctors stand in solidarity with their peers. Doctors and clinical officers say this will remain the case until the government listens and offers solutions to the problems plaguing the healthcare sector and its personnel in the country.
Because even in the negotiation, they are the ones who walked out, they left us sitting, meaning they did not have any plans or any arrangements to actually agree with us. We have gone to the extent of consolidating our issues from 19 to 10, but they still do not have any offers from their side. They have not moved at all. It means that they don't care.
Telling them they're not employees of MTRH. In KNH, my colleague fell sick doing a ward round. She couldn't be seen in the facility where she works in. Who speaks for them?
Shame.
You study, you work. The same government that has sponsored you to go to school, they don't pay the school fees. So when exams come, you're frozen out of that exam. You repeat a whole year.
The doctors' union and the government have, in the wake of the strike, attempted to resolve the crisis through conciliation meetings as well as the whole-of-nation approach, bringing together all the ministries involved. These have been unsuccessful, and now the doctors say the ball has fallen in the president's corner.
Him who is to protect the Constitution. And in Article 43 of the Constitution is the one where every Kenyan has a right to access health care. When people who have been appointed in the offices, or people who have been given jobs in different departments are failing, that it means the leader of the country has to come out and defend the Kenyans to get the health care.
The Ministry of Health has remained adamant that it will seek to re-examine the doctors' 2017 CBA since it was signed under the previous regime.
Solidarity forever.
In the meantime, the crisis in the sector is set to deepen as the laboratory technicians are also set to down their tools on Wednesday.
The union makes us strong.
With talks at the negotiating table all but grinding to a halt, the doctors' union and the government are set to face off again in courts on Wednesday as they seek a resolution to this crisis that is bringing the healthcare sector to its knees. Brenda Wanga, Citizen TV, Nairobi.